best thing you could really do is stop avoiding this issue and get an independent assessment of your current strategy. A lot of people are avoiding it. What we're seeing is a lot of folks, especially those that I work with, moved to a December 1st renewal date for their health insurance plans. The reason was it was enabled them to save a little bit of money because some of the taxes and fees in the ACA were able to be avoided for one more year. But the problem with that is they're going to have to make some serious decisions by December 1st, because if you think about it, all of their brokers are going to be having to service all of their accounts in 1 month, and it's going to be difficult, especially if they see rate increases beyond what they were expecting. So after you assess your strategy, and you can do that many ways. You could have somebody within your organization do it. You could rely on a existing professional advisor that you might have. You could work with an independent consultant, or you could work with somebody to train someone within your organization to do it. But you're going to have to begin making these strategic planning changes. This is a change just like anything else, and the approaches to change are doing nothing or moving forward. And so putting a process in place to manage this change is going to be extremely important. Ensuring compliance is going to be achieved by staying informed and communicating with all of your parties. What I mean by parties is your customers as well as your employees. What many employers don't really realize, because there's been some delays in this so far, but there's a lot of reporting requirements in the law, and that's going to cause some confusion. For example, October 1st, they have to send out a notification informing all of their employees of all of these things, and I'm sure that can cause some confusion. So developing a communication plan with your employees, should they come to you with questions, having a response in place will be really important. Okay. So just to review the assessing your current strategy, I kind of hit with that. As you make that change, start by organizing your payroll data and make sure you're beginning to measure your employees. That's extremely important. The easiest way to do that is to get to determine how many full-time equivalents you have. And the easiest way to determine if someone is a full-time equivalent is to look back at your payroll data for 6 months and look at those individuals that are paid, or that worked rather, more than 780 hours over that 6-month period. The ACA kind of has caused some heartburn for many in the service industry because it changed the definition of a full-time employee equivalent to 30 hours a week. So 30 is kind of the new 40 in many ways, and a lot of these companies are a little bit concerned, but they can make that number look a little bit smaller if they're able to measure that data and make some appropriate changes with onboarding employees. Next thing you need to do after you kind of get an idea of what your risk is, and you would do that again by determining how many employees you have, you need to ask yourself, do you offer coverage or not? If you offer coverage right now and it meets standards, chances are you're probably not in as bad shape as you had originally thought. The question now will become, how do I do my best to lower my claims and utilization and educate my employees, because chances are the rates will probably go up next year, and early indications are starting to show that. And so it might make sense to consider budgeting for future cost increases now. Well, one of the things I encourage is kind of looking at this as a 5-year deal, and I think it's going to be 5 years at least, maybe more. The law had a 10-year implementation period. Kind of begin budgeting for those things now so you're not in as much problem down the road. And then finally, identify other issues needing your attention and formulate some strategic things to help make that happen. Let's go to tip number 3. Organization and communication is essential. I talked about it earlier, but the final regulations were released in early 2014. A lot of folks had been waiting for them, and it's going to be important that you, as an employer, either if it's not provided to you by a CPA, or if you're not getting it from other advisors, maybe try and work out a system on your own. And it's going to be important that whatever you decide to do, that you document everything and do the best that you can to show a reasonable effort to comply with the law. And take advantage of this extension right now and voluntarily comply this first year. because when the official employer report comes, that's going to be in April in 2016. So tax season 2016, there's going to have to be a new form on your taxes that you're going to have to show things like, for example, whether or not the coverage offered met minimum standards, whether the employee had the opportunity to enroll a spouse, total number of employees by month, whether employees' effective dates were affected by a waiting period. The list goes on and on. So really trying to get these things organized and voluntarily comply, do a dress rehearsal, if you will, for 2014 is important. And again, I can't stress enough how important it is to communicate with employees. And then tip number 4 is really continue to educate yourself as best as you can. I really appreciate you sharing your time with us. I know it's really hard as a business owner to get away, but really understand why costs are so high. Administrative overhead, as Professor Cutler talked about, is a major problem. For example, 1/3 of our healthcare costs are in overhead. An example that I like to use commonly is, how many of you out there have gotten something that says this is not a bill? I've got a file cabinet full of them, and if you think of it, that's got a cost that doesn't really improve health. All of these things are resulting in higher premiums, and I think, again, the way to lower costs is by educating and promoting wellness. What are your obligations? You're going to have to file this paperwork like I talked about on this official employer report. I would suggest looking on the IRS.gov website to find the necessary regulations. If you don't speak bureaucrat, there are some consultants out there that can definitely help you understand that. And then finally, by December 1st, you're going to have to start thinking about that pay or play decision. Do you want to continue to offer coverage or not? I think a cost-benefit analysis is the right approach to determining that, because many of these things are changing, and I think the true challenge, or the true thing that we're going to really have to worry about in about 5 years or so is what happens with these larger companies as they see that many people decide, if they decide, to drop coverage and send them to the exchange. What's going to happen with these new excise taxes? I think it's coming in 2018, taxing health insurance plans that are above a certain amount. And if healthcare premiums continue to rise, this could work itself into some sort of a alternative minimum tax. And so I think over the next 5 years, I began this part of the talk talking about thinking about this as a process. Over the next 5 years, I really think a lot of these people are going to be having to take this pay or play decision through a cost-benefit analysis. And I think the key variables that are driving this decision will be the size of the company. And that is, of course, because of businesses over 50. For the most part, there's a little help the first year, but in the law, over 50 have to offer coverage to their full-time workers. Employee wages is another important thing. For 2 reasons. Number one, it's going to affect how much you can charge them, because there's a safe harbor in the regulations. You can't charge more than 9.5%. So what a lot of people are doing is picking the safest way to do it is take your lowest paid worker, and you cannot charge that person 9.5% if they work over 30 hours a week. And so obviously wages affects that. But then on the flip side, if you were to decide to drop coverage, you also have to factor in wages, because this law is going to affect a white-collar firm completely different than it would affect a blue-collar firm. If a company that employed a workforce that pays them $10 an hour decided to drop coverage, it might be more beneficial for their employees to do that. However, if a professional service firm that pays their people over $50,000 or more, there might be a different mindset. The example that I like to use as a kid was the Choose Your Own Adventure books. I always enjoyed those, and you read your chapter, and everybody's got to pick their own little adventure. And in many ways, the ACA is a Choose Your Own Adventure